Hi, I'm Allison.
Hi, I'm Fanta.
Hi, I'm Miriam.
Hi, my name's Jenny.
Hi, my name is Shivangi.
Hi, I'm Nico.
Hi, I'm Arlo.
Mental health is important as is, but especially during the period of adolescence where the teen brain is especially impressionable, and anything we go through makes essentially 3 times the dent than if it was an event to happen later in our life. Mental health is very internal. It's not something you can just pick up about someone as they're walking across the street. And that's what makes it really difficult to talk about and to help someone improve. Let's say someone had a broken leg and you just saw them walk across the street. It's probably very easy to tell by their limp, by them wearing a cast or them having crutches. And you can see them gradually improve as their leg heals and they might no longer need a cast and their stance is improving. But mental health is so enigmatic and ironically invisible because for the person experiencing it can be as visible as ever. And sometimes mental health struggles can actually impact the person more than physical impairments. And for all these reasons, why mental health is so difficult to identify, how it can be really invisible for people from the external point of view, that's why without the proper support from health professionals, it can be extremely harmful to the person experiencing it.
According to WHO, globally 1 in 7 10 to 19-year-olds experiences a mental disorder, which accounts for 13% of the global burden of disease in the adolescent age group. One of the main causes of illness and suffering among adolescents is behavioral disorders, which includes anxiety and depression. It's important for adults, including educators, parents, or even healthcare professionals, to address adolescent mental health because failing to do so will result in worsened physical and mental health, which can limit the opportunities that allow adolescents to feel supported and loved.
I used to work for a mental health research organization, and I've studied 4 main barriers that influence how likely people are to seek help. And the first barrier is very individualized to adolescents themselves. So, for example, if they've had negative or positive experiences in the past, that could influence how likely they are to seek help in the future. And the second overarching barrier is related to social impacts. So if the community where a person is raised or the culture in which like their family is from or something has a stigma toward mental health, it can be very difficult for young people especially to come out and be very vulnerable when they can be met with shame or disappointment from people they really care about and love. And that's something that I think healthcare providers should always keep in mind, which brings me to the third point of barriers. And the third barrier is related to assumptions people have about mental health professionals themselves. So young people are always worried about confidentiality, and again, if they're worried about stigma or shame, disappointment, those sorts of feelings that are very normal, it's important for them to know that healthcare providers will be keeping everything they share very confidential. And it's important to also know for both the young people and parents alike that sometimes it can take a few tries to find a professional who feels like a right fit. So whether it's related to culturally competent care or just maybe the vibes are just off, it can take a few tries to get somebody who you feel comfortable with to open up to. And then finally, the last point is related to just structural difficulties in accessing healthcare, especially in the United States where we don't really have a streamlined public healthcare system. So sometimes accessing care can have long wait list times and it can be difficult to find an appointment. And young people anyways are still very dependent on their parents or guardians. So things like costs and transportation and all those sorts of things can act as barriers. So it's very important to kind of make things as easy as possible, especially when you're catering your services to younger people. So maybe that could mean doing things more digitally, like telehealth sort of things where you can get on a Zoom and just chat with a therapist for a little bit. I know that people I know have done that and they've really enjoyed it because it's very accessible and tends to be cheaper since you don't have to go in office. Those are the 4 barriers that I've covered.
This one time when I was in freshman year, and I really wanted to talk with my school counselor, for therapy or circumstances at home. But there was this presentation that happened at the beginning of the year where the counselors went around to each classroom and were doing presentations on mental health, specifically depression and anxiety, and they were inviting students to go and talk to them outside of class for anything that they wanted to talk about. But one thing that they were adamant about when they were presenting was that they were mandated reporters, so they had to report any problematic things that were very worrisome. And that's totally understandable, but there was because of my circumstances at the time, I didn't really think that I could go and talk to them about certain things without consequences. I won't go into too many details, but I was experiencing some adverse childhood experiences, and so eventually, as time went by, I didn't really go and talk to the counselors as I wanted, and that's what happened for the rest of the year. And eventually, me and my dad were just washing the dishes together, and it was really casual, and we were just doing their thing, making small talk, and then I just made an offhand comment about how I was feeling. Just a comment about oh, this happened, and my dad was literally stunned into silence, and I kind of just looked over and I asked him what, you didn't know? And he was so baffled, and I just looked at him, really? But regardless, eventually we sort of resolved that circumstance, because it was at that moment my dad was able to listen and also going to help me because I had talked to him, and that was a really important thing for me. And I think it's also really important for teenagers with their deteriorating mental health and things like that, or with whatever circumstances they're facing. I think it's really important for them to reach out to people, and the stigma or even just lack of communication, misunderstandings, what happened with me, those things are really can be instrumental to things looking better and getting better. So I feel having the situation where I can be comfortable, a situation where I can be really casual with a trusted adult or a guardian is probably a really important method to have adolescents share out what they're going through. And yeah.
I would say accessibility is a huge gap in adolescents receiving mental health care, but there's also many subtopics within accessibility. One I would say is lack of culturally competent care. There are a lot of people of color that are afraid to reach out to therapists because of skin color barriers, or they have experiences of racism that they're afraid to open up about. And then I would say another thing is lack of time. There are a lot of adolescents that just don't have the time to go and reach out for support services that can help them because they're either working, they're in school, and they just don't have the time to squeeze in. And then I would say also affordability is a big one. There are a lot of low-income students, and they just can't afford therapy services. There are a lot of families that don't have insurance that, accept therapy services. And I think one thing that can help is having therapy services in school that are free for students. And then there's also, you can do therapy services through jobs. I know they are starting to implement therapy services through jobs that are free. So yeah, I think that's one thing that can help for sure.
Something I want adults to know about mental health is that it's just as important as physical health, and that mental health can affect a person's day-to-day actions just as much as physical health can. That's why it's important to know that you can't just dismiss a mental health issue by asking someone to either take a sip of water, go out for a walk, or exercise, because although these things may help a person feel better, it's not going to fix the problem. Another important thing to note is that a lot of times people just want to feel heard, and they want to know that there's someone out there who's ready to listen to their problems and who's ready to support them in any way they can.
I want adults to know that providing a solution or trying to solve the problem immediately isn't always the best thing to do. Sometimes it's just important to have someone listen to you, to be there, to simply just have someone near you. Recently I got into a car accident on Christmas Eve. I was on my way to work. It was icy. I was going 30 on a main road. I just simply was changing lanes and I rolled out. I was in a ditch. I hit a sign and I called my boss. She's the loveliest person in the world. I love her to bits. And the first thing she did was ask, "Are you okay?" I was calling to say if I was late. She just wanted to know I was okay. It was the most important thing to me ever. She stayed on the phone with me until my dad came. She talked to me. She had me do deep breaths, and I really appreciated it. Then when I came into work that day, she gave me a big hug. She wasn't trying to solve my problem. She wasn't trying to do anything else. She just wanted to know that I was okay, and she was there for me. And I want other adult health professionals to know that sometimes it's not about trying to solve a dilemma. It's about being there for the person. Because at the end of the day, adolescents are people too.
I'm very lucky to have a very supportive physician and come from a school where there is this community where they constantly tout a culture of promoting mental health support resources and that works on destigmatizing mental health struggles. In fact, my friends will just casually tell me, "Oh, I'm sorry, I can't hang out today. I have my therapy session this afternoon," or "Give me just 1 second, I need to take my antidepressant pills." And that culture where mental health struggles are very normalized allows me to feel very normal no matter the ups or downs that I'm feeling, and allows me to really explore the emotions I'm feeling. And when it comes for me to confide in a trusted adult or my physician, I feel like I'm able to be 100% honest of what I'm going through. And when someone is able to do that, they can receive the best possible care for themselves.
My healthcare provider has always been like my family doctor. I've had two. My first one was like a nice doctor. She like did her doctor things, and like we didn't really like have this connection, but I did attend a physical exam with her, and like she asked the routine questions, and at some point she became like really dismissive about like my responses to the questions. So I wish that instead of that she was more like if she ended up validating my experiences, that would have been much more helpful to like also for me to elaborate on my experiences more, so that like more intervention could have come early on. My second family doctor was in a new building, in a new setting, and this was after the pandemic, so it was like a couple years after my like first visit to the family doctor, and she had this really warm persona. She was really friendly and approachable, and she asked the routine questions, and my dad was like in the room with us, so I was also feeling really positive at the time, so I didn't like go too deep in like what I was experiencing as a whole like for the past like years, because that's like a lot of things to condense. And anyways, I was feeling really positive at that time, so I didn't really report anything, but I probably should have responded with sometimes I experience like really low like depressive episodes that I would like help for. Sometimes at those like certain times, I feel like if she responded with like redirecting me towards resources for those, or helped me like connect with her through like, I don't know, online portals, and if I could just like reach out at those times when I want to present a concern, I feel like that would be a good way for me to like access health resources through that. Yeah.
I'm going to be doing a poem about my experiences. According to Michigan.gov, who quotes the CDC, 4 in 10 teenagers experience persistent sadness and depression. According to the World Health Organization, 5% of adults have depression. And according to this study or that study, eating well and exercising will help solve the problem. Maybe vitamin D supplements help, maybe not. But according to my doctor, I'm a good person and I'm worthy. I deserve love. I deserve happiness and friendship. He doesn't say, well, everyone has depression sometimes. Even in my back steps, I get a congratulations when I say that I've brushed my teeth. And even if I misstep, then I know that I have someone to lean on, holds me with a nice firm hug and says that I did a good job. Even in my backtrack, I know that I can find someone when I'm lost, when I'm sad, when I don't know where to go. This is what it looks like to be someone who experiences depression but is loved and cared about. This is what it looks like when a doctor says your name, when a doctor says, I care about you, when a doctor believes that and they do that. And this is what it looks like when I can say, I'm beautiful, staring back at myself in the mirror and not having to say it through my clenched teeth.